Welcome to Beyond the Blade. I'm Dr. Boris Sepeshi. I'm a thoracic surgeon at Sarah Cannon Cancer Network, HCA Health One in Englewood, Colorado. In this video, we'll discuss an important role for community surgeons in early-stage non-small cell lung cancer. Perioperative IO-based regimens with neoadjuvant IO plus chemotherapy before surgery and adjuvant IO after surgery have recently been approved for use in early-stage non-small cell lung cancer. It's increasingly important for surgeons in community practices to know that these regimens are FDA approved for resectable non-small cell lung cancer and what the implications are for their practice, including the need to refer appropriate patients to a medical oncologist to discuss this treatment option prior to surgery. To discuss this, we have gathered academic and community surgeons with diverse surgical backgrounds and experiences with IO plus chemo before and IO alone after surgery.
I'm Sandeep Kandar. I'm a thoracic surgeon at the Virginia Cancer Specialist Practice in Northern Virginia.
I'm Olubenga Kusanya. I'm a thoracic surgeon at Thomas Jefferson Health.
Patients put a lot of trust in surgeons. They don't necessarily understand the biology of cancer the way we do, and therefore it is important for us to guide patients throughout the entire course of therapy rather than just through the surgical treatment.
When we talk to patients about lung cancer resection, we are often the last appointment. They've seen pulmonology, radiology, medical oncology, sometimes radiation oncology before they come to us, and tensions are always very high. They want their tumor cut out, and they want it cut out right away. Sometimes just removing that tumor and cutting it out is not always the best option. We know that recurrence rates are high.
I think it's really important to talk to our patients about what their available options are. The last thing you would ever want is a patient to leave your clinic, see a commercial, and then come back to you and say, hey, what about this option? Is that something that I'm a candidate for? So engaging your patients in a conversation about any particular option, I think, is reasonable, even if you don't think that's the option that they should take. But maybe in the case of a perioperative IO-based regimen, and that's the one they should take. So I think making sure to take the time to have an open discussion and build a relationship with your patient is really critical in order to move forward.
Here are key ways to talk to your patients about a perioperative IO-based regimen.
Number one, immunotherapy plus chemotherapy before surgery works in two ways. In preclinical models, it activates your body's own immune system to find and attack those cancer cells and destroys rapidly growing cancer cells. Additionally, giving immunotherapy after surgery may help remove any remaining cancer cells. IO may also affect normal healthy cells.
Number two, perioperative regimens are one of the latest advances in lung cancer treatment for early-stage non-small cell lung cancer and have been studied in several major clinical trials.
Number three, a perioperative IO-based regimen requires a team of specialists instead of just one physician to focus on you and your lung cancer. This ensures that your situation and all treatment options are discussed by all the relevant specialties so you can receive the best possible care.
Number four, with a perioperative IO-based regimen, as with all cancer treatments, you, as the patient, are the most important member of your care team. You should feel free to ask all the questions you have of the other members of the care team so that you're confident in the treatment you're receiving.
Number five, a perioperative IO-based regimen provides the opportunity before surgery to make important lifestyle changes such as quitting smoking, exercising, and other activities that might improve how you do with surgery.
Number six, perioperative IO-based regimens are recommended by lung cancer experts and treatment guidelines for appropriate patients with resectable non-small cell lung cancer.
Number seven, with surgery, our goal is curative intent. Perioperative IO-based regimens are the latest advance in the curative intent setting of resectable non-small cell lung cancer.
Doctors, thank you for sharing this helpful information for community surgeons to share with appropriate patients. I think it's important to emphasize that perioperative IO-based regimens are FDA approved and becoming a standard of care for resectable non-small cell lung cancer. They're also recommended by thoracic surgery guidelines as well as other treatment guidelines. It is critical that all community surgeons have open conversations with their patients and refer them to medical oncologists prior to surgery to ensure patients can make informed decisions on what treatment is best for them. Thanks for watching. Be sure to like the video and subscribe to this channel for more expert insights.